Good afternoon, everyone. We want to thank you for joining us today for the Flint Community Webinar on Coronavirus. This is week 118. And this webinar is brought to you today by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. These partners have joined together to bring to you the best information we have, bringing a local context to a global pandemic and addressing issues beyond. I'm your moderator today, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. And we are looking forward to this conversation we have today. Some late breaking news we're going to bring to you. So we want to appreciate those of you who joined us by Facebook and those of you who visit us by YouTube. And of course, those of you that are in the webinar. I want to remind you early on, as we are having our roundtable discussion today, please be sure to put your questions in the queue because we want to be able to answer them for you. Today, I want to, again, as every week, appreciate all of the partners who join us every week to participate in the background. Some of them you are not seeing their faces every week, but they're here to answer questions for you. We appreciate those who make their way here from the Prevention Research Center, from the Health Department, Genesee Health Plan, the City of Flint, the Michigan State University, and the University of Michigan. And today we also have someone from the University of New York, and she'll get me straight on how to say that as she talks to us a little bit more. Dr. Deborah for holding in the roundtable. It is a very, very exciting few days that we're embarking upon. We are now celebrating Juneteenth. And as many of you may know, this is a series of days in the month of June celebrating the freedom or the emancipation of African Americans. There were African Americans in the Texas area who had not heard that the Emancipation Proclamation had been signed. And so it was a series of days before everyone knew. This weekend, we're celebrating Juneteenth, and it is now a national holiday. For us here in Flint, I'm really thankful to be able to say for 50 years here in Flint, Genesee County, there has been a Juneteenth celebration. This was long before many people even understood it. So we want to acknowledge and recognize Dr. E. Hill Deloney. Mrs. Deloney, most of us know her affectionately by Ms. D. She received her Doctorate of Human Letters from the University of Michigan last year. And last night at the Freedom Fund Youth Dinner, she was celebrated. And so we today want to acknowledge the work that she's done for 50 years. She is known as the mother of Juneteenth here in the city of Flint. We can remember in those days years ago when it was just a few cars marching in a parade to celebrate this day. And now we have so many activities. We're going to have to tell you about some of them later on in the webinar. But again, let's appreciate and honor Ms. E. Hill Deloney, mother of Juneteenth. This is a traditional Juneteenth, and there are many Juneteenth activities happening across this community and across this nation this weekend. So today, as we've talked to you about before from the very beginning, bringing a local context to this global pandemic, we have a series of topics that we're looking forward to addressing in our roundtable, and our team is here. We're going to look at some vaccine updates. We're talking about conference protocols. Many people are now getting out and going to conferences. We're going to be looking at preparing for summer. And as I mentioned before, we have some late breaking news. There's some information that's happened here, and we've not forgotten about the Flint water crisis. So we'll be addressing some of those issues as well today and more. So please, again, put those questions in. Make sure that we get your questions answered. We did have some questions that we've been talking about for the last few weeks. We want to make sure that you recognize that we understand that maybe we don't get to all your questions during the webinar when they're posted, but we're mindful of them. One of the questions, why do we stop some vaccinations like smallpox instead of continuing to ensure eradication? That was a question. Is there a plan for a third booster from Pfizer and Moderna? And also another question, is the current endemic flu, and we talked about the difference between epidemic, pandemic, and endemic. Is the current endemic flu a variant of the flu from the 1918 pandemic? Had to go do some digging, and we'll see how we work on address that today. And of course, there's some questions about home testing, and we have addressed that previously. So we're going to ask our roundtable team, and I know we can only get a few of you on the screen at a time, but I'm going to ask Dr. Wilford, Dr. Deborah Holden, Dr. Larry Reynolds, And I see Michaela from the health department here with us this morning. Join me in this conversation. Oh my goodness. Uh, let's start here. Let's start here talking about um, the vaccine updates. There has been a history of vaccines. I want to start with you, Dr. Wolf. We had a little bit of a chance to chat about this vaccine history. And so if you could get us started with this conversation today, I'd appreciate it. Dr. Susan Wolford.
Thanks so much, Yvonne, for this opportunity to share about the vaccines. So, some of the questions that we saw, one of them was, is the current flu that we see seasonally, is it related to the COVID, to the 1918 flu? And indeed, it is related. So, it's actually very interesting how we know this because um, obviously back in 1918 they didn't even know that it was a virus for sure. They certainly didn't know what type of virus, but because they were able to get frozen samples, get samples from bodies of people who passed away from the flu that were frozen, they were able to use those samples and get tissue from the lungs and were able to test those. And it turns out that it was a H1N1 and related influenza A. So when we test today for flu and seasonal flu, and we test and we say, oh, we're testing for influenza A or B, and you may hear those terms. Well, that influenza A, that H1N1 type of flu, was related to the pandemic in 1918. Interestingly enough, that flu sort of went away as far as impacting humans, but spent a lot of time in pigs. And then that's why we were able to have the swine flu epidemic that came out, was it 2009 or somewhere around there? So, yes, to the question as to are they related, yes, they are related. One other question, to the question of why do we stop vaccinating against certain things like smallpox? Once something is eradicated, and interestingly enough, smallpox is the only infection that we have ever been able to say has been completely eradicated. We got very close with polio. It was eliminated in many countries, but it has not been eradicated. But smallpox has been eradicated. The last known case, wild type case caught out in being out in the community, that last case was in 1977. And so the thought is that when you weigh the risks from a vaccine, because as we've said, everything has a risk. So when you weigh the risk and you weigh the costs, and you know that there is sort of no COVID wouldn't that be wonderful if there were no COVID? When there is no smallpox out there, then you can say, okay, it's probably not worth trying to vaccinate everyone against it. And we probably will never get to the point where we say there's no COVID. We probably will never get to the point where we eradicate it, because it is not the kind of virus that likely we can really get rid of completely. So we'll always have to protect ourselves against it. Sorry, that was
Thank you,
kind
Doc.
of a long answer.
Yeah, are you walking on your treadmill, Dr.
I
Wolford?
am. Thank you so much for raising that point. I turned it down so that you wouldn't hear the sound. But one of the points I wanted to make today is that because we are always going to have to live with COVID around, likely it's not, and if not COVID, some other infection that's out there threatening us, we need to be in the best health that we can be in. And one of the things that impacts our immunity and our ability to protect ourselves is whether we're sedentary or not. And I have to admit, most of my days are pretty sedentary in front of the Zoom screen. So I've put up my computer in front of my treadmill, put a background so I feel like I'm walking on the beach, and I'm trying to make sure that I am less sedentary.
Thank you, Dr. Wolford. I want to just hop over to Michaela, and then I'm going to come to you, Dr. Reynolds. Michaela, I know you're one of the epidemiologists from the health department, and Dr. Hacker couldn't be here today to help address this. So she asked you to come in and fill in for her. So Michaela, can you give us some insights on these issues around this history?
Yeah, I don't have a terribly lot of information to add. Dr. Wolford really did a beautiful job with both of those questions. The only thing that I wanted to add is that I off the top of my head, I didn't know that the 1918, the flu pandemic was the H1N1 subtype that year. And I looked up this year, and this year for our 2021-2022 flu season, we are in the predominant type is the H3N2. So it's those two subtypes are the most common that cause human infection with influenza. So this year we're seeing more of that H3N2 subtype. And as far as our flu season this year, we've seen a higher amount of the influenza A virus than we usually do this late in the flu season. It usually starts out in the beginning of flu season heavier with the influenza A, and it kind of tapers off into influenza B. And that really kind of hasn't been the trend this year. We've seen some flu A kind of stick around later in the year than we have in previous flu seasons. So as we all know, respiratory illnesses over these past couple of years have really thrown us for a loop with, of course, with the COVID pandemic, and now influenza is doing a little bit of a strange activity compared to what it's done before. And as far as the history of vaccines, like I said, I think Dr. Wolford did a fabulous job of summing that up for us. I really don't have any further information to add to that. I think she did a wonderful job. Thank you.
Thank you, Michaela. Dr. Reynolds, I was going to come to you, but since she mentioned trends, can we jump over here to Dr. Deborah, because that's just right down her lane, because I know as this relates to as your pediatrician world comes out, I know you got something to tell us about how this impacts children. But Dr. Deborah, good morning, afternoon, I should say.
It's afternoon for you. It's morning for me. I'm in Los Angeles, so it's 9:12 here.
Yeah. So when we talk about these trends and this history, what say ye about all of this?
Well, so, me, I believe data is power, right? And I think about, what it must have been like for people in the early 1900s to not be able to have all of the information and dissemination channels and ways of getting information that we had. That also means that their misinformation networks were probably not as robust either. Or if they were, they didn't travel as fast. So I think it's important for us to, stay on top of what the trends are for COVID, because that knowledge should inform us. One of the things that I have found so interesting about this pandemic is people wait till we're at a peak to start to change their behaviors. And I'm like, no. When you start to see things go up, it would be the behavior shifts that would avoid us from hitting that peak. I come out of the substance abuse world as a researcher and a practitioner, and there's this fictional place that they call rock bottom. And rock bottom is a figment, it's a fiction. Because just when you think you've hit rock bottom, the bottom will fall out and you'll go lower than that. So I hope that we can sort of learn a lesson from that. And as we start to see things shift, the goal is not to wait until things are off the charts to implement strategies. We know what works. We know what effective, prevention of COVID infection looks like. And so it's about doing those things. And, to steal Dr. Reynolds' line, that the vaccine is the foundation for the prevention of the spread of this infection. So the best thing we can keep doing is to continue to encourage everybody to get vaccinated.
Thank you so much, Dr. Deborah. And you gave a good segue to Dr. Reynolds, because we're talking too about how to get prepared for summer. You just laid the foundation for him really, really well. Dr. Reynolds.
Oh, yes. And first of all, I'd like to say, in the past, we've tried to attribute the origin of a flu to a nationality or another country. We call things the Spanish flu. But if you got into Europe, they might have called it the Polish flu because there were some people who had certain prejudices. And then even using the name Asian flu, really doesn't add a whole lot to the science and what we have to do. And it does lead to discrimination. It does lead to violence against people who may appear to come from that area. And so I'm really impressed that we've been careful how we name the variants of COVID-19. So be on guard, because we are each other's neighbors. And believe me, the virus is not looking at the name we give it, nor is it looking at county lines. And the good news is our risk level in Genesee County is low, but I'll leave that to the health department to discuss. But what do you do between the surges or the waves? What do you do when it's low? Number one, you take advantage of this opportunity to get vaccinated, to get your booster. Number two, you still use good judgment. So if you're in a crowded situation, especially indoors, and you don't know who's around you, put on a mask, keep social distancing, wash your hands. If you get invited to the family picnic or the graduation or whatever, if you are sick, number one, get tested, get home tests. You can go to cdc.gov and order your tests, and they will be delivered within a matter of days. Learn how to test yourself. And if you don't know, ask somebody, and there are videos online. But if you are sick, don't go to a social gathering because you don't know right away that you have COVID or you don't have COVID. So please use good judgment. And those are the things we need to focus on. And then as a primary care doc, I have to say the same old thing. You know, we have many other conditions that we must deal with. And Dr. Wolford touched on this. We still have diabetes, hypertension, obesity, need to be screened for cancers, lung disease. If you have a chronic condition like sickle cell, you still need to be in contact with your physician. So all these things are still out there, and they don't care that they're competing with COVID. Sometimes, if you don't address these things, if you don't refill your medications and take them on a regular, as prescribed basis, you make yourself more vulnerable. Okay. Yeah. And now let's talk about kids more in detail. Okay. The FDA approved boosters with Moderna for ages 6 and up. Okay. That means 6 through 18, because Moderna earlier was not approved. Now it is approved. What's going on right now is the CDC, the Center for Disease Control, is giving the final decision on immunizing 6 months to 5 or 6 years old with the vaccine. So, you know, I got a call from a reporter and she said, well, don't you want to talk about it? And I said, wait a minute, we're halfway through the process. We really need, the FDA says it's safe and it's effective, but the CDC tells us how we are going to use it based on that information. And as a primary care doc, I stay in my lane until I get the final written information on how I should help my community and my patients. So rarely has it been rejected. So we expect to hear something. The conference started Friday at 10:30, so I couldn't get on, and it ends Saturday, and they will make a decision. So by Monday, we should have a good idea. Now, some of you all will say, well, then why did the government ship the vaccine out? Because we're in a pandemic, and we have to have things in place for when we need it and when it's approved, so it can be dispensed and people can be vaccinated as quickly as possible. So, you know, I'm waiting for orders just like everybody else. And please get your immunizations up to date. You know, I came through at the beginning of vaccination. I was born at that time, and we didn't have all these vaccines. And we had children who had multiple complications from viral infections and bacterial infections. And that's why we offer vaccinations before school, in infancy, and boosters through adulthood. And I have to say boosters because there's nothing new about the idea of boosters. And I'll stop with that.
Thank you, Dr. Reynolds. And I know we're pushing to. Well, I wanted to make sure we did address that question about the boosters as well as the vaccines. And one of the things I'd like you to touch on again, Dr. Deborah, for summer is how to wear the mask appropriately. I know we didn't get a chance to talk about that one, but that's sort of like in your DNA, because I just had a conversation with some folks the other day, and a young lady was telling me she was talking to her mom, and her mom had her mask down under her nose. And she says, I don't want to be, that's not the proper way to wear the mask. So as we're preparing for summer, can you give us some tips? And then I really want us to address this late breaking news as it relates to the water. So Dr. Deborah.
Yeah, so you said I had to go grab my mask, and because I traveled yesterday, and I'll tell you, when I traveled, I ended up on a nonstop direct flight. It was my flight, and I had a 6-hour travel delay, of which almost 4 hours of it I spent on the tarmac on the plane with frustrated people. So I was really happy that I had my mask. And something changed as we got into these more transmissible and what I call sticky strains of COVID. They just stick to stuff better. They stick in your nose better. They stick in your throat better. Some of them even stick to surfaces better, which means they're just easier to spread. So I call them the sticky ones. Having a mask that's well fitted and well filtering became more important. So where before we were using kind of the match test to measure air in and out, now we really need that. Plus we're looking for fit and filtration. So I travel with a KN95 mask. I don't use the N95s because I think this provides me what I need, and I don't want to be one of these people who are taking away critical supplies. We need those really in hospitals, but people have to do what they're comfortable with. But minimally, I recommend for people the KN95 or something like that, because it's got multiple layers of filtration. The same rule that is always applied still does. You want to put the mask on and take it off by the straps. And it's not hard, right? You just put it on and then you adjust it, and see, mine is fit all the way nice around my face. There's a little metal piece here. I squeeze it, because if I don't squeeze it when I have my glasses on, the steam comes up, and then I need little like windshield wipers for my glasses, because my glasses will fog up and steam up. So for me with glasses, that's a good indication that I've got my mask on and it's well fitted, because it's not steaming up my glasses. And then when you go to take it off, if you were out in the world and somebody sneezed or is talking in their spray, because a lot of places don't have mask requirements. There's no mask requirement in the airport or on planes anymore. So if the person next to you has COVID and they're breathing and talking, and even if you're talking to them and you got your mask on, if you go to take your mask off like this or pull it down like that, whatever's on the outside of the mask is now potentially on this hand. So you might go like this and then later go like this, and you just expose yourself. So I always tell people, don't touch the front of the mask the same way you put it on. You just pull your hands behind that, you put it on that way and you take it off that way. And then that's what I do. And I love my KN95 because that little pinch that I made in the nose now will make it sit up nice and tall. And I don't use a KN95 once. I will set mine off to the side. I got a paper bag at home. I don't wear makeup mostly. Will be the second use for this KN95 mask. I throw them in my paper bag, and I got a little row of maybe 2 or 3 of them, and I will recycle them and use them a few times. Yeah.
Thank you so much, Dr. Deborah. Appreciate that, Dr. Reynolds, Dr. Deborah. Let's just say this. There is an advisory out by the health officer with respect to the Flint River, and also from the mayor. We are being encouraged, and I know we're getting out. We've got a lot of Juneteenth activities going on, so we want people to remember to wear the mask, physical distance. Just be cautious out there as we're getting involved in these activities, but we are encouraged also to stay away from the water. Because there has been a film found over the water. And so the health officer has put out a medical advisory, a concern about the Flint water. There has been a leak in the water. So we just want you to know they're encouraging you not to use the water. And I want to just say, Dr. Reynolds, just if there's just one thing you want to say about this, has even come from the Michigan Department of Environment, Great Lakes, and Energy. They're looking at PFAS and PFOS. There's going to be some more information coming about that. But we do want to let you know, as we're here on the webinar today, and you're out sharing with other people, be mindful that they're asking us not to come in contact with the water in the Flint River. Dr. Reynolds.
Let's be clear. Someone allowed a leak of oily fluids to go into the Flint River. It has nothing to do with what our water system did. It was allowed to leak, and that is a crime and is being investigated. And besides not getting in the river or bathing in the river, don't eat fish out of the river at this time. I'm sorry, fishermen, I spoiled your weekend.
Yeah, thank you, Dr. Ennis. I just picked up the notice. This comes out of the mayor's office. No contact to avoid, and individuals are asked to avoid fishing, boating, and swimming in the Flint River from Stepping Stone Falls to the Genesee County line. So just quickly, just as a word of caution, let's be mindful of that. And again, it's separate issues, but it's still our Flint water, Flint River. So thank you all for that very, very detailed discussion. And we're going to move now to the next segment in our session today. Thank you, Dr. Reynolds, Dr. Wolford, Dr. Deborah, and Michaela. Thank you so much for sharing with us today. Now, it's really important that we understand what the data is telling us. And we're going to hear from Dr. Sadler.
Hey, folks. Yeah, so can we jump over to the next slide here? Thank you. So decent news for the, I guess, 4th or 5th straight week in Genesee County overall. The number of new cases declined. Flint is on a 3-week consistent decline. Our cases are now about where they were. What did I write down here? About where we were in like August or September of last year. So they're not as low as they were, say, in the summer of 2020, or when we had decreased quite a bit a few months ago. And of course, we have vaccines in the mix now, so there's a little bit better odds, I guess, as we're dealing with this. But one thing that I wanted to remark on today, since we're kind of in this downward slope, doesn't mean that we're, of course, ignoring continued risks. But now that we're, hopefully not, continuing this upward trend that we saw last month, one thing I wanted you all to think about for me and for my team is we've presented data in a couple different ways. We've shown some maps. We've talked about rates per capita, like per thousand population. We've shown you time trends. And one thing that I would be interested in is if any of you have interests in breaking down the data. Again, we've broken down data by race, by geographic location. Are there other ways that you'd like us to look at this data and boil that down? So that's an open question to everyone who's on this call here. And I'll probably make that request again in a few weeks. But that way we can keep coming up with infographics and maps and presenting data to all of you in a way that will be useful for you all and sharing with your constituents and your partners and clients and so forth. And also that will hopefully help us keep better and better tabs on what may be an eventual upswing in cases again, whether that's in a few months or next year or whenever that happens, because surely it will happen again. Thanks.
Thank you, Dr. Sadler. Appreciate that. And again, we hear you. We want to hear from our community members. So put those ideas, questions, you can put them in the chat, and we have his contact information. Please feel free to contact him.
Thank you.
And
yeah, one more slide. Just kind of a comment slide that again, the highest cases in May tended to be in those suburban areas. Flint was kind of in the middle, and northern Genesee County had the lowest rates. So.
You had a little map to show us?
Forgive me, I forgot there was stuff, it being one of the first weeks after the end of the month. Yeah, so again, these are just to illustrate the relative increase in cases from April to May. You see that despite Flint being larger than Grand Blanc actually had the largest cluster of cases. And then there was a little bit going on up there in Clio, and then likewise down in Fenton. And again, one thing that we keep tabs on is despite the fact that we have this shading doesn't account for the population. Like the population of the county is the densest through Flint and kind of through the middle of the county from Mount Morris Township down to Grand Blanc Township. So we always expect those to be a little bit higher, but we can tell that Grand Blanc Township's having a bit more of an issue this month, last month, than other municipalities.
Thank you, Dr. Sadler. We do want to just continue to be mindful to follow the protocols. Ashley is here with us from the health department. She's going to give us an update. Where are we with activities? And Ashley's going to give us a really good sense from the hospital perspective as well.
Yes, absolutely. I'd love to. So at this time, we are reporting 107,708 total COVID-19 cases. As Dr. Sadler had touched on, we are seeing a decrease in referred, confirmed, and probable. So with that being said, we do watch this in respect to our hospital movement, our COVID movement in the hospitals, any kind of increase in our cases, an increase in confirmed positives. We typically can still see some movement in the hospitals on days 15 through 17. That still holds true. So we're just keeping that in mind. This is definitely something that we watch closely during our summer months that have holidays, get-togethers, graduation season, prom season. So I'll definitely be a little more attentive to our hospital movement and numbers about 15 to 17 days from this weekend. As of right now, we do have 33 total COVID-19 inpatients with COVID as a primary diagnosis across all 3 hospitals. 3 of those are pediatric cases. 1 of those pediatric cases is a PICU case, or pediatric intensive care case. With those pediatric cases, I tend to be a little more attentive to that specific hospital. I tend to communicate a little more just to make sure that they have the resources they need. I mean, I do that with all the hospitals in general, but I like to keep that channel of communication open when we have our tiny humans in the PICU or an influx in pediatric cases of COVID. A small proportion of our ICU beds are primary COVID diagnosis. So we're looking at about 6% of the occupied ICU beds right now are COVID cases. I'm so sorry. My screen keeps flickering. And then as far as our vents are concerned, we are using about 84 vents at this time. Only 2% of those people that are vented are COVID cases at this time. As far as admission rates are concerned, that's definitely something that we pay very close attention to. We like to see any kind of fluctuation in average daily admission rates, as well as proportion of vaccinated to unvaccinated COVID admissions. Right now, we are averaging 5.4, which I know is kind of a wonky number, of 5.4 daily admissions of COVID across all 3 hospitals. We have a total of 87 total admissions for the month of June. So of the 87, 57% of those patients are listed as either unvaccinated, partially vaccinated, or vaccination status unknown. So that's something that we're watching. Past couple of months, we were seeing a greater proportion of those that were fully vaccinated being admitted, but we are seeing a very gradual shift to unvaccinated taking the lead. Okay, we are on day 521 of vaccination efforts. We have performed or hosted 842 COVID-19 vaccination clinics across Genesee County. We still have everything lined up in the books to continue COVID vaccination moving forward. We have no intentions of slowing down at any point in time, especially now that we are getting words of changing in vaccination parameters at this time. So with that being said, we typically move forward and we want to make sure that everything is full steam ahead. We have all the resources we need to continue to move forward. We do have pop-up clinics lined up, coming up. We have, as I said before, the months that typically have our bigger holidays and the warmer months, we tend to see more pop-up clinics. So in this case, we are seeing an influx in pop-up clinics for Pride Month. We have some veteran veteran observation, like a veteran stand down clinic. And then we also have some Juneteenth events that we're kind of working around as ice cream socials. So at this time, we're just making sure that we are relaying that information once those pop-up clinics are approved through our partner, Michigan United. Our 3 faith-based clinics are still moving forward as usual. So that would be Central Church of the Nazarene, Our Lady of Guadalupe, and Shiloh Missionary Baptist Church. So those are still full steam ahead. Our HANU sites, Word of Life Church, Bethel United Methodist, and Macedonia Baptist, are strictly still testing sites. There are no intentions of being a vaccination site again. So we're going to go ahead and make sure we relay that information. Hopefully people are not still going there looking for vaccination. And then as well as our other testing sites at this time, which these sites you can also receive a COVID vaccine. We've got Walgreens and Rite Aid, the very specific locations, so Walgreens on Davison Road, Rite Aid on Miller Road and Clio Road. And then we do have Hamilton Community Health Network for testing Tuesdays and Thursdays, and they're scheduled every 10 minutes at the North Point Clinic and the Burton Fire Station. So if anybody needs any additional support, if they have any COVID-19 questions and they cannot access our website, gchd.us, where we have listed every resource we have ever conveyed or communicated to the public, anything that you need help looking for should be on our website, again, gchd.us. But if you are experiencing any barriers with using the website, at this time, we're recommending you call our phone number at 810-344-4800. We ask that if you do have access to the website and you're able to navigate it safely, please do so. We want to keep that line open for those that are having barriers and unable to use the website.
Thank you, Ashley. I do have a quick question for you. You said
Sure.
a little bit earlier, you said vaccination changes. Can you clarify that?
We get tidbits from the state as information is reviewed. So in this case, they're looking at approval for 6 months, or from, I believe, 6 months to 4 years, because we are at 5 years now for Pfizer. So what they're doing is they're going through the phases to get the approval process for 6 months and up. So as you guys had touched on earlier, there are many stops to getting that approval process, and for us at GCHD to get the go-ahead to start vaccination for that new group that has been approved. So, most recently it's been boosters for children. It starts with, we've got the CDC, ACIP, and once we get the approval there, in this case, also the FDA gets involved. Then we also at the health department have to wait for MDHHS to give us our guidance, and then we can move on from there. So as you said earlier, there's changes, but we can never be too concrete on the timeline. We look at about a business week turnaround to get those changes in implementation and administration, but we can never be too sure. We can never give a concrete answer,
Right.
It's going to
So
be
so that corresponds with what Dr. Reynolds said earlier.
Yes.
These conversations are happening now,
Yes.
and we may hear on the news while it's approved, but we may not have authorization, is what you're saying, here locally to actually administer. And so
Correct.
we want to make sure.
Yeah, so even if ACIP gives the green light for the go ahead and everyone sees it in the news, and we do field these phone calls, we do get these phone calls once people see it in the media that it has been approved, and they call and say, are you doing it today? We try to relay as much as possible that we still have to wait for MDHHS to give us the go ahead, because the powers that be must make sure that everyone is on the same page, everyone has the same information, and we do it vaccine administration safely.
Right. Thank you so much, Ashley. I appreciate what you're doing there at the health department. So now our next update is our report is from the Flint Center for Health Equity Solutions. And we've talked a lot about health equity. One of the reasons why we have these clinics around our community is so that everyone has access. And that's one of our equity challenges, that sometimes people don't have access, even though things are available. So we're going to have Blair, who is one of the assistants at Michigan State University working along with us, a research assistant. She's going to give us our update from the policy brief. Welcome, Blair. Blair.
Oh, hello, sorry, I was muted. Okay, so I want to start by talking about mental health funding for students. In October 2021, children's mental health was declared a national state of emergency. To address the mental health needs of Michigan's K through 12 students, Governor Whitmer has proposed an additional $361 million for the upcoming school year. This includes $120 million for school nurses and counselors, as well as $25 million for mental health screenings in schools. Overall, Governor Whitmer has proposed a 7.6% increase in the upcoming statewide education budget. This brings the coming year's education budget to $18.4 billion. Increased funding for these resources will better support children's mental health and improve academic and behavioral outcomes. Secondly, I will talk about how Michigan, it remains at a standstill with proposed gun legislation improvements. This is despite the increase of firearm purchases and firearm related injuries, which are now the leading cause of death among children ages 1 to 19 years old. In Michigan since 2021, there have been 24 proposed bills to strengthen gun laws in the past year alone, but none have passed. The proposed bills include efforts to provide resources for safe gun storage, universal background checks, guidelines, protection for domestic violence victims, and more. Michigan ranks 18th out of the 50 states when it comes to the strength of gun laws and 24th for rate of deaths, which is 7% higher than the national average. Improved gun regulation could better protect Michigan residents against preventable gun violence and injury. Also pivoting to talk about a little bit about post-COVID conditions. It's sometimes known as long COVID or long haul COVID. These conditions are experienced by individuals who continue to have COVID-related symptoms for months after they have had COVID. Some symptoms include fatigue, shortness of breath, weakness, chest pain, memory problems, brain fog, and more. Somewhere between 10 to 30% of individuals infected with COVID develop some form of post-COVID condition. This impacts the entire household, though, from everyday activities and work schedules to social and emotional well-being. The takeaway is to do what you can to protect yourself, get vaccinated, protect your loved ones, and look out for these symptoms. That's what I've got.
Thank you so much, Blair. And this is just a perfect time for a conversation. I'm going to ask our panelists to come back from our roundtable. As you've mentioned, Blair, the Flint Center for Health Equity Solutions has the policy brief, and this was a real passion for work with Dr. Deborah, looking at health equity and ensuring that we reach that. Now, after we've had the earlier conversation and we see that there are still some issues, there's question, how do we live? And I'm paraphrasing, this is a great question in our Q&A. So I want to summarize and then we'll get to more details of the question. But we're seemingly moving into a endemic, we're still in the midst of COVID. Let's establish that. We're still in the midst of a pandemic. Is that correct? But we're beginning to act as if it's endemic. So help us understand, really how to think about this and what we should be doing. Now I'm going to look at your microphones. So when you come up, and I'm going to start with you, Dr. Deb, but if you, the other two of you, just open your mic up and I'll see you. But Dr. Deb.
Well, okay. So once we get to the point where, we understand, sort of what is the sort of expected amount of COVID, specifically SARS-CoV-2, right? Because coronaviruses in the family where these come from are already endemic, right? Coronavirus is the common cold, but this specific, family of the coronavirus that is the virus, that is the disease that causes COVID-19. So we're sort of moving into that phase. But what what endemic doesn't mean, and when people talk about it, it's a mistake that they make, is that we just accept it is what it is. And we say, well, there's going to be this amount of death and disability from, COVID, and that just is what it is. And we should just all learn how to live with it. That's not what endemic is. And people have made the mistake of saying, well, since it's just with us, we just need to learn how to live with it. And yeah, that is true. But learning how to live with it doesn't mean not practicing all of the good things that we know to do to help to reduce both the spread and the negative impacts. People getting sick, people getting hospitalized, people dying. And so we're moving to that phase where basically it looks like this is now here with us to stay, right? But endemicity is also about learning how to properly manage it so that we're not like where we were in the pandemic when our hospitals were overrun. And that was a terrible period. And I'll never let people forget the stories of people dying in waiting rooms, people waiting a whole 24 hours to get a broken arm or a broken leg reset, people contracting COVID in the hospital. So as we move into this period of endemicity or it becoming endemic, probably the most important thing is for us to first figure out what will it look like and what are the best things that we could and should be doing so that we minimize the impact and the toll that this virus takes on our population. Thank
you. And I see you leaning in, Dr. Wolford.
I think Dr. Reynolds was unmuted before me. Did you want to
go?
I'm
sorry, Dr. Reynolds. I missed that. Dr. Reynolds.
We also have to think about vulnerable populations. There are people who have to work face to face every day. One of the reasons the rate has come down is some of us are privileged to work from home, but we have bus drivers, we have support staff, we have people who work in the food industry, public safety, who have to show up to work every day. So we can't assume that the risk is equal for everybody. The risk of getting infected and the risk of complications. And then you have to consider people my age. Well, we could even back it down to 60, 50 and older. Those are the folks that are going into the hospital. Those are the folks who are having complications. And yes, the vaccine reduces the risk of those complications, but does not eliminate it. So we really have to consider the people around us. And right now, infants and toddlers and pre-K, they have not been vaccinated. So we have to consider their safety also.
No, that's an important point, Dr. Reynolds, before Dr. Wolford, because there are people who cannot get vaccinated. And I know it is really an encouragement for everybody to get vaccinated. For those who can't, those of us who do, and also follow the protocols, we're helping protect them. We're protecting ourselves, but we're also protecting others. Dr. Wolford.
Absolutely. Thank you, Yvonne. We are our brother's keeper. And there's a proverb that says, in all you're getting, get understanding. We have been able to learn so much more about this pandemic and about COVID, and all of us have much more knowledge about viruses than we ever had, 2 years ago. And we need to put that into action. In looking back at the data about the 1918 flu, one of the things that was striking was that people were wearing masks. They didn't know what this was. They had no vaccine to protect them, but they realized this was something in the air and they were wearing masks. Not the mask, not a KN95 like Dr. Deborah just showed us how well to put it on, but they wore what they had. Now, we today, we know that we can have the mask, we can wear that, we can protect us and protect others around us. We know that if we're getting sick, we should socially distance. We know that we should do everything we can to keep ourselves as healthy as possible, and we know that we can get vaccinated, and now down to 6 months of age. We need to use that. And remember, early on in this, we kept saying, it's a bit like the weather report, trying to show you my umbrella here. You don't just run outside without thinking. One checks the weather, checks to see, are the numbers going up? Is the place I'm going to be crowded? We think about these things so that we can put all that knowledge into action so that, as you said, not only can we protect ourselves, but we can protect those amongst us who cannot use as all the layers that we can use to protect ourselves from COVID.
Thank you. I'm going to just pick up another something that's in the Q&A. The question is, holidays with Juneteenth. There's a lot going on. I'm going to give some announcements because we didn't have enough space to put it all on the screens today. But so many events today. Holidays coming up. Family gatherings, social gatherings, expecting to increase those numbers. So, how do we address this concerns about what persists, because the country is open again, and we talked about masking. So I'm just going to say we're repeating what we've already said. Layers of protection. Dr. Reynolds, tell us what those layers of protection are.
The first layer is your brain. Think before you act. And that means, and then I'll go to Dr. Deb's famous theme, have a plan. Don't do anything without a plan. So if you're sick, have a plan for that. Definitely stay home. If you're well, think about who you're going to be around after your social event. And you've heard me say before, Saturday, I go see my 93-year-old mother. I get tested. I test myself before I make that visit. And if I have any symptoms, I don't go. And when I do go and I'm moving throughout the public, I keep a mask on, and she's fully vaccinated. So you have to have a plan, and then stay in contact with your primary care provider. So if you have a problem and you test positive, you can there are some antivirals that may be appropriate for you. So you must stay in contact. And if you don't know where to go, you can go to Hamilton, you can go to GHS, you can call the health department, but have a plan and wash your hands and maintain physical distancing. And my wife accuses me of being antisocial or a hermit these days, but I really select where I will go and under what circumstances.
Thank you, Dr. Reynolds. Dr. Deborah, you add to that?
I'm looking in the Q&A, and I'm looking at Azania Hayward James, who has dropped some real gems in here by way of comments and by way of questions. And she makes an important point that I just want to highlight, because I think it's a great point, we're still battling people's thoughts and ideas about the effectiveness of the vaccine. And I'll just say it because if anybody out there needs to hear it, the vaccine is safe and effective at preventing severe illness, reducing the risk for hospitalization, and severely reducing the risk for death. You can't come back from that. And as we heard from Blair, which I appreciate that she picked this up in the policy brief, it also looks like it's good at helping to reduce and prevent long COVID and reduce the risk of long COVID. And I'll tell you, as somebody who suffered a bit of brain fog for the two and a half months after I had my last COVID infection, I'm grateful. I can't imagine what that might have been like had I not had the vaccine. And then another comment, and I'm just giving her credit and sort of reaffirming what she's saying, is that, all of the concerns that we have about the fact that we know some of the structural factors to help prevent the spread of COVID, like improved air handling and air exchange systems in certain buildings, that we haven't done that. And in certain workplaces, we know improving air exchange improves the spread of COVID and reduces the spread of COVID, right? Getting old air out and bringing fresh air in, and that we've got some disparity in who and what types of employees have been called back to work. And maybe we might have some disparities in which places have done that. So I'll just give her exact comment. That's a little bit of background. And she said, concerns persist because the country is open, masking is optional, and human behavior is what it is. And the question is now, how do we shift structurally to this new reality of an endemic framework? And what does the previous strategy look like? And how is it amplified by a complementary, multi-pronged policy action effort? And I will say one thing, so just thank you for that comment. She more made them, I'll throw them up so other people can see it. We do need to, if you go back to this model of these multiple, layers of protection, some of them are individual, and there are things that are in your hands. You can control whether or not there's a mandate for masks. Wearing a mask is smart if you're indoors. It's smart if there are lots of people around, even if all those people are vaccinated. But there's individual responsibility, and then there's the world of our shared responsibility, and then there's the governmental responsibility. And I do think it's imperative on us to not take our foot off the gas and remain active and dedicated to getting those government resources and those governmental responsibilities handled. Because it's entirely right. Our school children would be better served if during COVID, the air handling systems and air exchange systems in the schools were updated. We already knew schools needed, this kind of work. And so one of the things I fought hard against is us putting all of the responsibility on individuals, but individuals do have responsibility, but there are also these societal and governmental responsibility that we could be backing up with good policy. So that's why the policy brief is something we want to bring to this group every week so they know what legislation is happening. But as these elected officials are coming out now, because election time is here, these are the type of things that you want to say to them. When we've got millages and things like that coming up, these are the kinds of things you want to be asking for, making sure that schools and workplaces, now that we know air exchange is important for improving the interior environment, that those places are not left out of these resources in the political agenda. So I just encourage people, stay the course with that individual and keeping the press on our elected officials for the government's part.
Thank you. And one last question. We've got about 30 seconds on this one. Can you clarify who in our community cannot get vaccinated? Dr. Reynolds.
I'll throw that to Dr. Reynolds because he has his hand up too.
Yeah.
I would say most definitely check with your primary care doctor first about who can get vaccinated. I can't recall the list off the top of my head. Next week, I can bring it to you on the CDC website, unless Dr. Wolford is primed and ready. But one thing I want to say is we need to remember more than 1 million people just in this country have died of COVID. There are over 200,000 children who do not have a primary caregiver or even their grandparents because of COVID. And the effect has been greatest in Black and Brown communities. So don't believe the hype that we've turned the corner. We still have to look out.
Thank you so much. I mean, there is more to come. Thank you all, doctors, for coming back for this mini phase 2 roundtable, because I didn't want us to miss that opportunity. And we have some great announcements now. We have so much going on in our community. We want to hear just some quick community highlights. We want to remind you that water will still be available at our 3 health centers through the end of December. So if you're in need of water, visit those health centers and some of those health mitigating foods that they have: Bethel United Methodist, Ashbury United Methodist, and Greater Holy Temple. We also have a number of Juneteenth events. There were so many Juneteenth events. I'm sorry, let me just address this. A public session, a public information session. We talked about water a little bit. Public information session. Racer Trust has been doing work in our community for several years now, and they have an update for us. So if you are available, go to the City Hall Dome on Thursday at 6:30 and hear the update from the Racer Trust. They're going to be talking about what's happening on the Buick City property, and they'll give a little bit update on the impact that they're seeing as it relates to PFAS. But today, as it was mentioned in the question, there are a lot of activities. There's a concert going on this tomorrow evening for Juneteenth. There is so many activities. So if you want to see Mama Soul, one of our own, tomorrow, June 18th at 8 p.m. to 9 p.m. And they're saying bring your own lawn chairs. It's a free event sponsored by a number of community partners. This is sponsored by primarily by the city. The traditional Juneteenth activities are going on. They have an event that's starting at 2 o'clock today at the Sloan Museum. 2 o'clock today at the Sloan Museum at 1221 Kersley. And there will also be an expo tomorrow at the expo tomorrow at Flushing Professional Suites. Their Black Wall Street will also be tomorrow, downtown Flint. So there are many Juneteenth. It's too many for us to name off today, but I want you to encourage you to look on the various sites about what's happening with Juneteenth. One other group is sponsoring a Juneteenth event, Michigan Faith in Action. Today from at 6 p.m. at the McCree Theater, there will be some activities at McCree Theater from 6 to 9 this evening. It is so wonderful to know that all of these things are happening in our community and you have an opportunity to be a part, but let's be sure to follow those protocols, stay safe, and protect yourself and protect others. We want to encourage our community health workers to please stay on, get your community health worker credits by filling out the form. Health social workers, get those contact hours, stay on and fill out those forms to get the contact hours. And if you have any questions, you can check with Atosia. We like for you to continue to follow us, join us, like us on Facebook, and also subscribe to our YouTube channel, Healthy Flint. We are asking you also go to Healthy Flint, info@healthyflint.org. We are launching a new website. So when you go to that website, you'll see some new information, but it is still the Healthy Flint Research Coordinating Center, just update. Or you can call us at 810-835-2130, and we'll be happy to answer questions. Join us next week. Dr. Reynolds already said he's going to have some good information for us next week. So we're asking you, take care, enjoy the weekend, but join us again next week for the Flint Community Webinar on coronavirus.